Patients and families are Stoughton Hospital's #1 priority. To provide trusted health information to our patients and community, we present Stoughton Hospital Health Talk with Melanie Cole.
Going to the hospital, even for something routine, can be daunting. For people struggling with dementia issues, however, it can turn into a monumental task. My guest today is Heather Kleinbrook. She's a registered nurse at Stoughton Hospital. Welcome to the show, Heather. So tell us, what does hospital's dementia-friendly efforts mean?
Sure. Well, we know that age is the biggest risk factor in developing dementia, and as our population is increasing in age, the incidence of dementia is increasing as well. And so we thought, being a healthcare organization, we really have an opportunity and an obligation to make Stoughton Hospital a place where people with dementia and their caregivers can come and receive care where they feel supported and safe.
When people come in, if they have people with dementia or Alzheimer's living at home with caregivers or family, and there's some emergent situation where they have to come into the hospital, what do you want them to know about bringing that loved one in?
Well, one of the things we did in becoming dementia-friendly is that all of our staff and volunteers have been receiving training on how to work with people with dementia and support their caregivers. Some of that training is, just simply how to approach somebody with dementia, how to help them if they're feeling confused or scared. There's, different needs for people with dementia when they're in the hospital. And so we wanted to focus on some of those things where people could feel more supported and safe.
Sometimes when you're dealing with people with dementia or Alzheimer's, it can be a little intimidating because you're not sure what you're discussing if they're picking up on it. How do you train your staff to deal with those kinds of issues?
Well, sometimes it's just the little things. Making sure that we're approaching people from the front and within the line of vision, and making sure we're introducing ourselves and being kind, friendly, and positive, and keeping calm, speaking clearly and with simple language, and sometimes making eye contact and smiling is enough to build these trusting relationships that people can feel more comfortable and at ease.
And if somebody with dementia comes in on their own and is very confused, how do you pick up on that?
Well, I think some of the things, it's obvious if somebody is coming into our organization and they might appear lost, they might appear scared. Maybe they're wandering and uncertain of where they're going. And it's really important for us as an organization to have all of our staff feel comfortable approaching these folks and asking questions and building relationships to make sure we can get people to where they need to go, and again, to have them feel supported.
What inspired you, Heather, to start this effort?
Well, I'm the manager of our geriatric psychiatry program here at the hospital, and we see a lot of patients on our unit who have early dementia or have behavior problems associated with dementia. And I know within the past several years, our state in general has looked at a Wisconsin redesign system for folks with dementia. And part of that redesign program is we found a lot of people with dementia are living in our communities. And we thought it was really important to look at those folks in the community and trying to find out what we can do, not only as a hospital community, but as a Stoughton community as a whole, to make these people feel comfortable and supported, where they can come out of their houses and still be engaging in the community to the best of their abilities.
Heather, how do you transform the areas to make them more friendly to people with dementia? The lights, the noise. I mean, there's a lot going on at a hospital.
Yeah, there really is. We took a really good look at our overall environment, and we have a lot of progress. We've made a lot of changes, but we also have a lot of works in progress. We began to look at improved signage throughout the whole entire organization and in different departments. One thing we've done well at Stoughton Hospital is that we really focus on customer service. And anytime somebody enters our building, we have staff and volunteers greeting those patients or visitors and escorting them to their destination. We've looked at simple things like artwork throughout the organization, and where we've replaced some things that were more abstract prints with things that have been more photographs or local photography that really invokes conversation and reminiscing. We've looked at replacing flooring with low contrast or less reflective floor surfaces. We've looked at improved lighting. and just looked at making more of a peaceful environment by reducing noise levels. And on some units, we've even looked at more calming alternative therapies such as aromatherapy.
Tell us the difference between Alzheimer's and dementia, because people just assume it's Alzheimer's if somebody is having memory issues or age-related dementia.
Dementia is really an umbrella term for memory problems, cognitive decline, and just general executive functioning and thinking. Alzheimer's is actually a type of dementia, but it's the most common type of dementia. That's why you often hear those terms interchanged.
And in just the last few minutes, wrap it up for us with Stoughton Hospital's dementia-friendly efforts to get your staff to understand what's going on, and what do you want caregivers to know when they are going to bring in a loved one to the hospital that has dementia or Alzheimer's?
Well, I think the big thing is that, we were able to train our staff and provide an environment that is safe. I think that people with dementia will feel supported. I think anytime somebody with dementia is in a different setting, an unfamiliar setting, that can be very scary and very terrifying at times. And I want people to know that when they come to Stoughton Hospital, those folks will get great care and feel supported and well cared for.
Thank you so much for being with us, Heather. We applaud all the great efforts that you're doing there at Stoughton. This is Melanie Cole, and you're listening to Stoughton Hospital Health Talk. For more information, you can go to stoughtonhospital.com. That's stoughtonhospital.com. Thanks so much for listening.